Oh. Hi, we're at the Coronado Sharp Hospital, and we're here to interview Cabot at the Motion Center.
My name is Cabot Fowler. I'm a fitness instructor at the Motion Center.
What was your education needed to get the job?
My education, I graduated from Humboldt State in 2005 with a degree in kinesiology, emphasizing in athletic training. And basically to get this job here, I just needed some sort of degree in kinesiology or something with the health sciences, exercise science area.
Okay, did you do any internships at all, like, to get the job?
No, I just had a family member who worked at the hospital, and I just applied for it, and based on my credentials and my education, I was offered an interview and then offered the job.
What do you enjoy most about the job?
Just being able to hang out with the members and just do something that I love, and that's sharing my knowledge as far as fitness, nutrition, with the members and my clients that come in here.
What do you least enjoy about your work?
What I least enjoy? I really love what I do. There's nothing that I least enjoy, but sometimes with all workout programs and with any rehabilitation programs, sometimes you hit a plateau or you hit a wall, and sometimes those are frustrating. But usually about 100% of the time, I'm able to overcome those things with the clients or with the patient, and we actually get more accelerated and better results as a result.
Do you utilize your work outside of the office?
No, not much. Just here. I'm actually in the process of becoming certified as an athletic trainer. So when I do that, I really want to start volunteering at high schools. That's where I got exposed to athletic training when I was playing football in high school. And so when I get certified, I want to volunteer in high school, maybe at my alma mater here in San Diego, or maybe at a school somewhere around the area that just needs help and would benefit.
What are your hours and schedules in the office?
My hours, I close every day or 4 days. We're open 6 days a week. I close 4 of those days. So I'm here 4 to 7 and 1 to 7 on some of the days.
How did you get interested in the job?
Interested in this job? Well, I guess it just goes back to just with my interest with the whole field in general. Like I was just mentioning, I played sports in high school. I would get injured, and I really got exposed to athletic trainers and therapists early on. So when I went to college, it's something I definitely want to study: sports medicine, athletic training. And so I selected a school that had that program, and I just love doing it. I love working with athletes, and not just athletes, but people who are non-athletes as well. I don't get to work with athletes all the time. I just get to work with people who maybe never even played a sport, but just really are conscious about their health and longevity.
So, did you realize that you wanted to go in the sports medicine field during high school?
Yes, yeah. In fact, one of the things that I looked at when I was looking for colleges was to see if they specifically had sports medicine program. Because it's really what I really wanted to do. In fact, I had a chance to go to Berkeley, but because they did not have a sports medicine program, I didn't go. And so I really was looking for schools that had. They turned when I applied, they turned me differently. Some went to athletic training programs or sports medicine programs. But if they didn't have it, then I really was not too strong.
Is it hard choosing what activity and exercise you're gonna have your patients do, or is it kind of you can tell right?
Yeah, you just it starts when they walk in. You know, when the first time I give them, it starts when they walk in, just observing them and just how they carry themselves, and then a lot of the stuff comes in forms they fill out. Health history questionnaires and things that I receive from the doctor, and really it's through talking with them and getting the history, getting subjective information from them, is what really gets my mind going as far as, okay, we can do this. We definitely probably don't want to do this in the beginning, but this we definitely can do, and this is going to be really great for that. And so just right away, even sometimes without being able to talk to them, actually seeing the information they put down, I can say, okay, well, this person needs to do this, so these exercises will be great for them. Now let's go ahead and meet them and see if they can actually do these exercises.
I see we have a really nice gym in here. How often do you guys have to like clean like the benches and places where people they might drip sweat or?
We clean every day, and actually around the gym we have boxes of gloves. We also have those little containers with the green top on the containers. Those are actually wipes that are positioned throughout the gym, so that whenever a member is done with a particular machine, they can actually wipe it off themselves. Okay, and then at the end of the evening, I'll go around and I'll wipe off the mat, wipe off some of the handles, some of the other pads that may come in contact with the patient.
Yeah.
This is a really cool exercise that I'd like to do for. You mentioned basketball, and this is really fun. And not a lot of people have both, and obviously we don't have basketballs or anything like that. But if you had a basketball, even if you didn't have a BOSU, you can use have a square pad, and it's just really great for balancing your basketball coordination and being able to balance. Being able to dribble, keep that. Switching, you switch, balancing. And for most people, you'll notice that sometimes one side works better than the other. And so I'm really big on circuit training, just going from station to station, keeping your heart rate up, minimal rest as possible, and just really utilizing, like I was saying, the balance, the balance type stuff where you're balancing here, and you're doing a bicep curl, shoulder press. So like I was saying, I did circuit class. So basically, I was showing Nicolette here that I left some stickers up from yesterday on different stations. So we did 5 stations. We did a leg circuit yesterday, and then 5 stations. So station 1 was a dumbbell press. The ball. You can grab some dumbbells and lay on your back here. Rather than pulling in, pressing up. That's a good one. And one of the exercises that I learned when I was an undergrad as a student athletic trainer, especially when I was working with one of the basketball women who had a complete ACL reconstruction, had a PES transfer, and then also had some work done on the meniscus as well as her MCL. But you come here, this is actually doesn't look very hard, but it actually is very challenging. Hips up and just holding it there for 30 seconds. And you can just feel it all over your leg. Hamstrings, glutes, quads, leg. It really works there. It was really great for her knee and just developing and just isometric strength in her hamstring and her quad. To get that area strong for her. Some weights. And these 3s are just for demonstration. I don't lift 3 pounds. For demonstration only. And so just a dumbbell row. Coming up this way. Again, this can be easily done on a bench, but when you add the ball in there, it adds an element of instability. There you go. And element of instability. So you kind of work your core, your glutes, tighten your glutes, keeping your core, your belly button pulled in nice and tight. Then also getting a workout for you. That's why some people use 25, some people use 12, but it was great for developing grip strength as well because you're holding the dumbbells there, you're doing them here, you're doing 15 of those. You're doing like 60 repetitions. So just holding the dumbbell with that weight just really worked on the grip strength and the forearm strength as well. So when you work with dumbbells, unlike some of the other machines, you have to grip them. Otherwise, you won't have the weight. So it really works on grip strength. works on the isometric strength in the forearms. So I know my hands were kind of tired yesterday. I'm pretty sure theirs were too. But yeah, that's what I do around here.
Thank you very much.
You're very welcome.
For letting us
You're sweating. Hey, the powder guy. My powder guy's leaving. Powder guy. The powder. I'm shining over here. It's nice to meet you.